A living will and durable power of attorney. Now, it can be confusing to figure out which documents kick in and what they mean. So a living will is a type of advance directive, and it is a legal document that must be notarized with your signature, in which you specify to your future healthcare team what your preferences are on end-of-life treatments. Treatments include dialysis, if your kidneys were to stop functioning, a mechanical ventilator, also known as a life support machine, if you're unable to breathe or need assistance with breathing, feeding options that are feeding tubes if you are unable to swallow safely, such as from a disabling stroke or worsening dementia, and then CPR is a common one. CPR means cardiac pulmonary resuscitation, in which they involve chest compressions and breaths which are often replaced with a mechanical ventilator. Now, this document is a legal document, and once you have that, it's a good idea to make copies. A durable power of attorney, also known as a medical power of attorney, makes decisions on behalf of you when you're unable to make them yourself. Now, a medical power of attorney cannot be confused for a financial power of attorney. They're different in that a medical power of attorney does not get to make decisions on financial matters, except for when applying for public benefits such as Medicare, Medicaid, and the medical power of attorney can have access to financial records. What if you don't have a document? And let's say you weren't able to orally designate anybody either. So we come across this issue quite often. In the hospital, we usually have patients who have discussed to some extent their medical wishes, but often we do face scenarios in which we have patients who are terminally ill and no one has any document. The state allows the physician to decide the best surrogate for you. And in Arkansas and many other states, there is a very strict hierarchy of whom we ask or approach for medical decision-making ability. So the first is usually the spouse that is not legally separated. She or he get the first right to make decisions on behalf of you if you are incapacitated. After the spouse, you have adult offspring, and then after them, you have parents. After parents, you have adult siblings. After that, any relative, and if there aren't any relatives, any adult. Usually in situations where we don't have a surrogate or we don't have anyone that is available to make medical decisions, we will consult with the hospital ethics committee to decide what's next. It's also very important to remember that the living will and the medical power of attorney documents only kick in when you are unable to communicate or have the capacity to make your medical decisions. Capacity basically means that you have the ability to understand the risks and the benefits of treatment. And there are medical conditions that can take that away from you, whether it be temporarily or permanently. If you are no longer able to make your medical decisions, that's when these documents kick in, and as a doctor, we will be approaching your medical surrogate or medical power of attorney for further decisions. In my next video, I'm going to discuss the terms DNR and CPR.